Thanks again for choosing Balance with Britt. Today's topic is going to be non-bedside nursing jobs that I've had or I've done. There are a slew of nursing jobs that are not at the bedside. And in some of my previous videos and shorts, I've included a list of different nursing specialties that one can go into. Especially if you're not interested in going into the bedside or you've been at the bedside and you're ready to try something different. So I have a background in ICU. I've been a nurse for 10 years and I've done a slew of things. I usually have 2 jobs at a time, which is how I'm able to do different things at a time. Outside of ICU and med surg, which were bedside nursing jobs, I've done utilization management, which is working from home and reviewing requests for procedures from insurance companies that patients are needing. And with utilization management, utilization review is basically getting the criteria, making sure things are medical necessary for patients that have the procedure done, like a CT scan, an operation, a heart cath, things of that nature. Like the doctor would put an order in, try to schedule it, and then it would come to the insurance company to authorize and do a review if needed, if it's not automatically approved, to see if the patient qualifies to get that procedure. And I've done that working from home. And another position I've worked in was triage, telephone triage for palliative care. I did that working partly from the office and then working from the home, where we would receive phone calls from patients that were on the service that were being seen by nurse practitioners in the home. And if the patients had a question, a medical need, or something urgent that they had a question about, they would call in at any time with us. During the day, we would be available to sit there and answer the phone and kind of talk them through some things if we could. And if it was something that we couldn't talk them through, we would get the nurse practitioner out there or get the nurse practitioner or doctor to give them a call. Also, I've done clinical review outside of utilization management, which is looking over pharmaceutical requests and medical needs for patients. By looking at that and either looking at the criteria and the medical history that came in the doctor's orders and the laws, especially when it comes to opioid and pain medication, things of that nature. And we would review that and then send it off to another party, whether we approved or denied. If we approved, we went ahead and sent it off to the insurance company and pharmacy to be approved. If we denied it, then we would send it off to be looked over from a legal standpoint. That way we would have a third party kind of review and see if the patient actually qualifies for it. Because sometimes we're wrong. Sometimes the information we get needs another eye or somebody else to kind of take a different look at it from a different viewpoint to say, well, this patient really does need that. Also, another gig I've been doing and I'm in full time is instructing, a nursing instructor, going back to my nursing school where I got my BS in and working adjunct and then eventually becoming full time and working there with students is a whole nother land of joy, especially going back to a place that taught me a lot. I'm able to give back to the same area and students that are in the same position that I was in. Another area is like the OR, PACU, pre and post. Right now I'm in PACU, which is recovery. Patients come out of the surgery room or operation room, and then they come to us either on the anesthetics or local sedation, things of that nature. And we basically keep an eye on them until they wake up, make sure they're waking up good and that everything's turning out fine. And then we give them education and their family members education for them to go home with after their surgery. Another area that I've worked in outside of the bedside in the hospital was home health. I do have a little one, so when I did get into home health, it was very helpful as far as my schedule, being able to go and provide care in the patient's home. There's good and bad sides to that. Some people can make that job a little bit difficult, but you find that everywhere, inside the hospital, outside the hospital. And then some patients were just like family, me taking care of them and being able to provide a service, whether it was medication education, doing wound dressing changes, PICC line changes, things of that nature to kind of help them smooth things over until they're able to get back to their doctor. Those were a couple nursing gigs that I've done outside of the hospital. I feel like I'm missing something, but for the most part, I've done things inside the hospital and at bedside, ICU, Cath Lab, med surg, post-trauma, LTAC, all of those were kind of in the hospital and direct patient care. Cath Lab is not necessarily at the bedside, but you do provide patient care. You don't hold on them too long, and it's more of like a surgical service. So that is something else that you can kind of look into outside of bedside nursing. We also did interventional radiology in the same area, and EP, which is basically like them coming in for heart procedures, like getting a pacemaker placed and things like that. So just keep looking out there, ask others, share if you've done a nursing job that's not at the bedside that I did not list or I have not done. Provide education, because when I got out of nursing school, I thought it was just bedside. And that was it. It didn't dawn on me that there's a whole nother slew or realm of nursing gigs and jobs outside of just being at the bedside or going for my NP or DNP or things of that nature. So thanks again for joining today. I made them kind of short, just kind of go over some things of what I've done as far as nursing in my 10 years of nursing. If you have any questions, feel free to drop them in the chat. And if you have any nursing jobs that aren't at the bedside, feel free to drop those in the chat as well. Thanks.